Hello, I'm Elsa LaVita. I lead patient advocacy at Cullinan Therapeutics, and I'm so pleased to be joined in conversation today with Tony Sreih, who leads clinical development.
Thank you so much for inviting me.
You hold a really unique dual role as someone who is a practicing physician and also a drug developer. How does seeing patients influence or affect the way you approach drug development?
I'm I would say, in a lucky position to be able to see the patient's journey and apply it to clinical research. In a sense, bringing the patient's voice to the table. Because when you observe the patients and accompany them through their journey, you see the challenges, what matters to them, the symptoms that they're interested in improving. So understanding the perspective of patients and what matters to them in terms of getting better helps me understand how to focus our therapies.
In your view as a practitioner, what are some of the greatest unmet needs that people living with Sjögren's, lupus, and rheumatoid arthritis are facing, and where do the current therapies fall short?
Currently we have so many more options, but unfortunately we're still not there. We need better ways of diagnosing, better ways of treating our patients, and not just the symptoms, but the underlying cause of the disease. And I always sort of hopeful of finding this therapy that allows our patients to live, to go back to their normal lives and be off medications.
What is it about Sjögren's that makes it so difficult to diagnose in many cases?
It's a complex disease and heterogeneous disease and can affect multiple organs, and not everyone presents the same way. It's hard sometimes to differentiate what is related to an autoimmune disease and what is related to a more common condition or medications or underlying other types of conditions. But also I think the factor that we are facing is the lack of awareness or the disregard of patients or the misunderstanding of certain autoimmune diseases, thinking that, for instance, Sjögren's disease is only a dryness of the eyes and mouth, not knowing that Sjögren's disease is a systemic autoimmune disease that can affect any organ.
Can you explain what immune reset means in relationship to autoimmune diseases? And then, as you're speaking with your patients, how do you explain immune reset in everyday terms?
In everyday, yeah. The problem with the therapies that we have is the best therapies that we have is that we suppress the immune system. We're not retraining it. We're not resetting it. Imagine your computer sort of starting to freeze up on you and malfunctioning. The first thing that you do is to push the reset button and then to reboot it, hoping that you allow the normal processes of the computer to take over again. And the same thing, what we're trying to do with immune reset is to shock the immune system in a way to get rid of all the bad cells and allow the healthier cells to come back and start functioning well and not attack the body itself.
So what gives you the greatest hope for the next generation of autoimmune disease treatments, and in particular, their ability to give patients a better quality of life?
We need therapies that address what matters to patients. What excites me about the new treatment within rheumatology is the ability to allow the body to reset itself and generate again a healthier immune system, therefore allowing the patients to be off medications for a prolonged period of time, not having to deal with the medications and their side effects, but also feeling better and close to back to how they lived before their disease. That gives me a lot of hope, and that's why I decided to join our company, controlling the disease and getting rid of some of the medications, if not all, would be a super jump into the hopeful future of medicine.